Meet Marcus, a 58-year-old smoker whose NSTEMI went undertreated. He now presents with sudden, crushing chest pain that hasn't stopped, along with cool, clammy gray skin. Notice, Marcus looks critically ill, pale, sweating, anxious, nauseous, and gripped by a sense of impending doom. The crash cart is placed nearby, and the family is called given the risk of sudden deterioration. His ECG shows clear ST elevation, prompting a code STEMI. Troponin is drawn, but may still be normal initially, since levels take time to rise even as damage is actively occurring. Interpret. ST segment elevation myocardial infarction, or STEMI, is a heart attack caused by a blood clot that has blocked a coronary artery. Because the blockage is complete, it cuts off oxygen to the full thickness of the heart wall, causing a transmural infarction, rather than the partial thickness damage seen in NSTEMI. Marcus's plaque, which had been narrowing his vessel for years and partially clotted during his NSTEMI, has now fully occluded, cutting off all blood flow to that section of his heart muscle. Every minute without blood flow means more permanent muscle death, making this the most time-critical stage of his disease progression. Respond. The cath lab is activated immediately, with 2 IVs started and the growing clipped in preparation. Marcus chews 324 milligrams of aspirin, and the priority is emergency stenting along with heparin and a GIIB/IIA antagonist like integralin to restore blood flow as fast as possible. If the heart cath is delayed and symptoms started under 12 hours ago, fibrinolytics are given. He remains hospitalized for 2 to 3 days to monitor for reperfusion dysrhythmias, and on discharge, he's placed on a beta blocker, an ACE inhibitor or ARB, baby aspirin, a P2Y12 inhibitor like clopidogrel, Plavix, and a statin to protect his heart. Reflect. With rapid reperfusion through stenting or bypass, Marcus's pain resolves and his heart muscle damage is minimized. Without prompt treatment, he faces complications like cardiogenic shock, dysrhythmias, or cardiac arrest. In summary, STEMI is a complete blockage of a coronary artery causing full-thickness heart muscle death, marked by ST elevation on ECG, and requires emergency reperfusion through stenting or fibrinolytics to save as much heart muscle as possible. If you study to remember, you will forget. But if you study to understand, you will remember. Author unknown.